Hey there! Quick question for you. Have you ever shared your medical information online or at a clinic and wondered who actually protects this data and how safe is it? If that thought ever crossed your mind, you're not alone. Because today, we're diving into HIPAA Security Rules, the healthcare regulations that make sure your sensitive medical information stays private and secure. And trust me, understanding these rules is more important than ever. Welcome to Bluehat Cybersec Academy. So, what exactly are HIPAA security rules? Well, HIPAA, or the Health Insurance Portability and Accountability Act, was enacted in 1996. Its goal, to make healthcare more efficient while protecting patients' personal information. The security rules specifically focus on electronic protected health information, or ePHI, and they tell healthcare organizations exactly how to maintain confidentiality, integrity, and availability of sensitive patient data. These rules apply to healthcare providers like hospitals, clinics, and doctors' offices, health plans including insurance companies and HMOs, healthcare clearinghouses, and any business associates that handle patient data on behalf of these organizations. In short, HIPAA security rules are designed to prevent unauthorized access, use, or disclosure of electronic health information, making sure patients' privacy rights are respected, even in a digital world. Now, let's break down the rules into the core components that keep your data safe. HIPAA security rules are built around three main types of safeguards: administrative, physical, and technical. Administrative safeguards. These are the policies and procedures that help organizations manage security effectively. For example, conducting a risk analysis to identify vulnerabilities, implementing risk management strategies to reduce threats, assigning a security official responsible for HIPAA compliance, training staff on security awareness and procedures, and preparing contingency plans like data backups, disaster recovery, and emergency operations. Physical safeguards. These protect the hardware and physical spaces where ePHI is stored. Think controlling access to servers, computers, and storage devices, using secure workstations, protecting against environmental hazards like fire, flood, or theft, and ensuring devices storing ePHI are properly disposed of or reused safely. Technical safeguards. These deal with technology and electronic systems. They include access controls to make sure only authorized people can view ePHI, audit controls to track who accesses the data and when, integrity controls to prevent improper alteration or destruction of data, transmission security to protect data when sent electronically, and encryption for stored or transmitted data. Why HIPAA security rules matter? These rules aren't just legal requirements. They're essential for building trust between patients and healthcare providers. Breaches in ePHI can be costly and damaging. Financial penalties can reach thousands or even millions of dollars. Reputational damage can erode patients' trust in an organization. Legal liability can arise if affected patients file lawsuits. Beyond compliance, HIPAA security rules encourage better data management, staff accountability, and security strategies, all of which protect both patients and organizations. So, let's talk about some of the challenges in HIPAA compliance. Healthcare organizations face a bunch of hurdles. Keeping up with evolving technology, like cloud storage, mobile devices, and telehealth, well, that introduces new security risks all the time. Staff training is absolutely critical, because honestly, human error is often the biggest threat out there. Managing third-party vendors or business associates is another tough one, since they also need to comply with HIPAA regulations. And finally, organizations have to find that balance between accessibility and security, making sure staff and patients can efficiently access data without ever compromising safety. So, what can healthcare organizations actually do to ensure compliance? Well, they should conduct regular risk assessments to spot vulnerabilities, use role-based access controls for staff, encrypt ePHI both in storage and transmission, train employees on security policies and phishing risks, maintain audit logs and monitoring systems, and, keep contingency and disaster recovery plans up to date. So, let's look at a real-world example. Imagine a clinic that stores patient records in a cloud system. By following HIPAA security rules, the clinic would limit access to authorized staff only, require secure login and two-factor authentication, train staff on handling sensitive data and recognizing phishing attempts, and physically secure devices and servers storing patient information. By implementing these safeguards, the clinic reduces the risk of breaches and ensures patients can trust their data is protected. HIPAA security rules are, honestly, essential for protecting the confidentiality, integrity, and availability of electronic health information. Following these rules isn't just about avoiding fines, it's about building a culture of trust and security. By combining administrative, physical, and technical safeguards, healthcare organizations can protect sensitive patient data while delivering quality care. In short, HIPAA security rules form the foundation of healthcare privacy laws, guiding organizations to keep the most sensitive data safe and secure. Here's a quick challenge for you. Can you name 3 types of safeguards under HIPAA security rules? And just think about this. Does your doctor's office or clinic follow these rules for your electronic health records? Pause for a moment and leave your answers in the comments. I'd love to hear what you come up with. If this video helped you understand HIPAA security rules and how healthcare organizations protect your data, go ahead and like, share, and subscribe to Bluehat Cybersec Academy. And don't forget to explore our governance and compliance playlist for expert tips on keeping your organization secure and compliant.